Yeah, I know. Oh, well, good morning this morning. Happy Monday morning, everybody. It is Monday morning. It's a beautiful Monday morning. Many of you know I'm traveling today as well on business. We've got some big things cooking. Hope you guys are having a blessed day. We're going to talk about a few things before we get into it. Where's everybody at this morning? Where are you guys watching? Where are you guys watching from this morning? Let's give everybody a second to jump on. It is a beautiful day today. Hope you guys are having a great day. All right, we got Amber. Good morning, Amber from Ohio. Deborah, good morning. Hey, good morning. How are you doing today? Trisha, good morning from Bama. Cool. What part of Bama are you in? I was just in Bama. Cynthia, good morning. Sasha, good morning. Hope you guys are having a great day. Hope everyone's doing well. Hope everyone is really being diligent and reading the headlines and seeing what's going on. I just want to have a conversation with you all. I'm not going to be long. I've got to catch an airplane here in a few minutes. So I just want to talk about a few things. Number one, how many of you have heard about what's going on in Florida? Did you hear that Florida I think it was just yesterday, posted some, it was all over the news. They just posted some of the largest numbers, 15,000 people tested positive, 15,000 and some change. Let's have a conversation about that. 15,000 people showed positive. Remember, those tests are looking at antibody test and serology test, the PCR test. So understand that every time someone goes to a hospital, they're getting tested. Okay, so every time you go to the hospital, whether it's routine surgery, whether you have a car accident, whether you have an injury, gallbladder attack, whatever, every person is getting tested at the hospital. You're going to be finding way more tests because of that. So if we're testing more, we're going to be detecting more. In Florida, they just did the same day that there was 15,000 tests were positive. They tested 140,000 people in that day. Let me say that again. 15,000 people test positive, which again, please remember the FDA is saying that there's all kinds of false positives and false negatives with these tests. Please remember that just because you test positive or just because you test negative, who knows right now, the jury's still out. These are not FDA approved tests. These are not certified tests. They haven't gone through the rigors of FDA, scrutiny yet to tell us if these are gold standard tests or not. So 15,000 people in one day tested positive. That's what the headline says. What the headline didn't tell you is that those people that tested positive, there were 140,000 plus people that got tested that same day. Do you understand that? That's huge. So just understand that means also Florida for the past 3 days has seen a reduction in the percentage of positive cases. Do you understand that? They're seeing a reduction in the percentage of positive cases. So the more people they test, the more we're going to detect. Understand that. But we're seeing a percentage going down. So I'm just so blown away why the mainstream media is going, oh my God, another gruesome number, a horrible, gruesome number today. Look at the percentages of going up. Yes, but deaths are still going down to the point where we're almost losing epidemic status. By the way, something will happen because the powers that be, the people who are planning this thing out, are looking at the facts that people are seeing that the numbers are going down, the death rate's going down. People are seeing that hospitalizations for COVID are going down. Hospitalizations are going back up to normal. Remember, most hospitals normally run 85 to 90% capacity. Please remember that. 85 to 90% capacity is a normal hospital. So, you guys, that's a big deal. We're going back to normal. We also have this thing called surge capacity. Do you remember a couple weeks ago, it was the end of June, whenever, I think it was a Memorial Hospital in Texas, it was in Houston, and they said ICU is at 100% capacity. Well, what they didn't tell you, it's in the article of Newsweek, but what they didn't tell you is that 75% of those people that were in the ICU were non-COVID patients. Let me say that again. Were non-COVID patients. That's what's happening. So I believe this to be true because like this whole week I'm meeting with because Missouri is under attack big time, just like your states are. I'm literally meeting with city councilmen and women, state representatives, congressmen, decision makers, lawmakers, because people are trying to figure out what to do. We're just a few weeks away from our children going back to school. And everyone's trying to do the right thing, right? Nobody wants to be wrong on this thing. And everybody's, quote unquote, erring on the side of caution, right? But here's the deal. The error caution of what? Children, you literally have 2.5 times higher chance of getting struck by lightning than you do a child testing positive for COVID and dying from it, or having a severe illness from it. Now, yes, there are kids that are immunocompromised, just like there are adults that are immunocompromised. These folks should stay home until we have reached herd immunity or until those folks feel comfortable going out in the community. That is a small percentage. We cannot make the same mistakes that we did in the past, letting these infections getting back into nursing homes. That's a big issue. The 48%, what they're saying right now is 48% of COVID deaths in the United States, 48%, almost 50% of the deaths of COVID deaths have been in nursing homes. Did you understand that? And if you look at the numbers, what I was talking about with the Texas hospitals, if you got the Texas hospital numbers and you showed that yes, the detection rates are high, but the ICUs are still not being overrun by COVID patients. They're not being overrun at all. They're actually at their normal capacity. You guys, it's really unfortunate that the media is truly lying to you this much. And please listen, here's what I'm going to say. Please prove me wrong. Please prove me wrong. And it hasn't happened yet. And there's nothing I've said about any of this COVID that has not been proven true. So please understand that this is a fear technique. We were talking about the same things, the same lies that were being told to us 6 to 8 weeks ago are now being told to us again. Hospitals are being overrun. No, they are not. More people are on ventilators than they were before. No, they are not. If you go and you actually look, go on my Facebook page and I'll post some more stuff just as soon as I get off here. But you got to understand that they're not being overrun. And the vast majority, in fact, 75% plus majority of people that are going to the hospitals are going there for non-COVID related issues because that's where people are going. Because people's health insurance sucks so bad and they don't know where to turn. And there's hardly any private practice doctors out in the practice anymore. They're all working for the hospitals. So where do people go with their health problems? They go to the hospital. It is hospital policy now that every person that steps foot in the door has to get a COVID test before they can come in. So even if you're coming in for routine checkups, even if you're coming in to have a delivery, even if you're coming in to get a gallbladder moved or a shoulder surgery or something you've been putting off since the beginning of the year because of COVID, you are going to be tested for COVID. And there's so many false positives, number one, that you got to be aware of. And number two, viruses spread. That's what they do. Please remember, go look it up on the FDA's website, the CDC's website. If we were testing everyone in America every year for the flu, H1N1, we would find 30 to 40 million people being infected or detected with flu virus. Please remember that. Please remember that. So whenever someone says, oh my gosh, 15,000 people in Florida detected in one day, please remember we're in Florida. Florida tested 149,000 Floridians that day. So the detection rate's gone up, but the percentage of infection has gone down. That's huge. That's huge, you guys. And by the way, the death rate's continually going down. Literally to the point where in the United States, it's getting close to dropping down below 5.5%, which is going to cause you to lose epidemic status. What are they going to do then? Keep your head on a swivel and be aware of what's next. So this whole week, like I said, I'm traveling all over the place, all over Missouri primarily. I got to get back to Missouri because here's the deal. Every county is under attack right now, and politicians are getting a lot of pressure from folks that are very ignorant because they're getting their information just from the mainstream media that's feeding them a line of crap. Stop watching mainstream media. You guys, also, one thing that just came out, it was a couple days ago, in New York, in some of the boroughs in New York, they're showing a 68% positive rate for antibodies in New York. I get it. I get the fact that the testing is flawed. I get it. But the fact that we're showing 68+% antibodies means that they have reached herd immunity. When people tell you that you need 90% for herd immunity, that's not true. You need 57 to 67% of the population that could be exposed and have detrimental problems with it to have infection so that you can actually have herd immunity. There are many states that probably already have it. By the way, there's a 97.5% survival rate. Sorry, 99.5% survival rate. 99.5% survival rate of COVID-19. So what are we doing? What are we doing? You guys, this is crazy. Now, I also want to dispel some myths. Those of you, and I can only speak for Missouri, I spoke to 2 state senators, a congressman, and I called out to Lambert Airport because I'm actually flying back into St. Louis, and I wanted to know if there was any type of quarantine, mandate quarantines going on. And they said, no, there is absolutely no mandated quarantines anywhere, none anywhere. But what there's a suggested quarantine that if you come from a high infection rate, which by the way is everywhere, that you should self-isolate for 14 days. That's not a law. There are no laws. There are no laws. Remember, you guys remember civics class, right? Government. There's the legislative, executive, and the judicial branch. The legislative branch, senators and congressmen are the only ones that can possibly pass laws that if you get a fine are enforceable. There are no laws on the books. So if you're getting threatened with jail time, which by the way I think is really ironic because you got states that are having mass exoduses of inmates, literally mass exodus of inmates that are leaving, that are getting out of prisons, that are criminals because of COVID-19 infections. But if you don't wear a mask, they're threatening to put you in jail. That's not true. That's hearsay. I'm hearing that from adults. You guys, I'm hearing conversations from adults, and it reminds me of being back in 5th grade, hearing the rumor mill going on. There are no laws that are mandating this. Now, a business has absolutely every right. Now listen to me on this. The business has every right to not let you patronize their business. They have every right to do that. Every right to do that. Listen, just like if you remember a couple years ago when there was a bakery that didn't want to make a cake. There were a Christian bakery that didn't want to make a cake for a gay couple. And you remember that went all the way to the Supreme Court, and the Supreme Court said, yes, you have to, or the state ruled, yes, you have to make this cake for them. So let me just say this. Is there a double standard? Is there a double standard? Is there a double standard that says a business can deny you for this, but they can't deny you for that? Think about that for a minute. If you want to wear a mask, you are entitled to. You are absolutely entitled to. You also have to remember that the vast majority, probably 80 to 90% of people are wearing masks incorrectly. Please also remember that just last week I did an interview on the Viper radio show that with a PhD Nobel Prize winning doctor, Dr. Mario, what was his first name? Dr. Mario Molina, who wrote a paper that is under huge scrutiny right now that's getting ready to get retracted from the medical journals because they did not do any research. All they did was get numbers from the World Health Organization that said when we put a mask mandate in, the numbers go down. That's not true. The infection numbers are higher, the detection numbers are higher now than they've ever been. Has nothing to do with mask wearing or social distancing or quarantine. Has everything to do with that's how a virus works. You guys have to understand that's how a virus works. We've got to get back to the basics of virology and physiology and biology and understand how these things work. And yes, there are things that you can do. There are things that you can do. There are so many things that you can do. The number one factor that we have to understand with COVID-19 is it's not about how many candles on your birthday cake. It has nothing to do with your age, even though the vast majority, some 80% of deaths that have happened from COVID-19 have all been from people that are over the age of 80. Please understand that. That's a fact. That's a fact. And any one of you that are commenting below that's saying that you're getting fines, those fines are not enforceable. Just like a red light camera is not enforceable. These fines are not enforceable. Get an attorney. They will fight it. There are thousands and thousands of attorneys right now in the United States that are fight your stuff for free right now because it's wrong. It's wrong. The Michigan cannot put a $500 fine in for you. Jane, I'm telling you, there may be some people that get those, but they're not enforceable. It's not a law. Understand that. Again, it's just another way to scare you, to force you into doing something that you don't want to do. That's the truth. If you want to wear a mask, wear one. Most people are wearing them wrong. I debated Dr. Mario Molina, PhD Nobel Prize winning scientist, last Friday on the Viper, and he said, you know what? There's no research that shows that you should wear a mask outside. He's for wearing masks. He said, yes, there was a slight reduction. What they did, they looked at the infection rate after the 2 weeks in April, whenever there was that anomalous spike of all those deaths, because people were dying in nursing homes. 60,000 people died in nursing homes of COVID-19 because of improper treatment by our government and our systems. That's the fact. So here's the deal. You've got to get your immune system boosted. You've got to understand. People are asking, do I know Dr. Bartlett in Texas? Yes, I know Dr. Bartlett. I know Dr. Buttar. All of us run in the same circles because we're all trying to help you. We're all trying to help each other. We're doing what doctors are supposed to do. First, do no harm, and second, help as many people as we possibly can. And yes, I'm losing my voice because I've been talking nonstop for the past 6 months. 6 months. Now, what do you need to do? How do you get healthy? How do you improve your immune system response? You guys, it's not about the birthday candles on your cake. It's not the number of years in your life. It's the life in your years. It's about your health. So what do we got to do? We got to make sure that we're eating clean, drinking lots of water. You guys, we have got to get healthy and as healthy as we can, especially before flu season kicks up again. Because remember, October, November, December, January, February, and even March, that's when, especially in the Midwest, where it's drier out and it's colder out, viral load in the atmosphere is higher. Remember, whenever humidity is on, like it's 100 degrees right now, humidity is high, the viral load in the atmosphere drops down really, really low. This is important. It's important to understand that. You got to get healthy. You got to load up on that zinc. You should be taking 25 to 50 milligrams a day of zinc. You should be loading up with vitamin C every day to bowel tolerance. Every day to bowel tolerance. You should be taking a good probiotic every day. You guys are asking about Dr. Zach Bush. He's a good friend of mine. He's actually speaking the same day I'm speaking from the same stage I'm speaking at in February in Costa Mesa, California. You got to load up on a good probiotic. You got to take fermented foods every day for your gut bacteria. You have to have a good microbiome. You have to make sure you're taking vitamin D. D as in David, every day. The average adult needs 10,000 IUs a day. 10,000 IUs a day, and the average child needs 2,000 IUs a day. That's what they need. I promise I'm taking care of myself. I've just been working really hard for you guys and my family and everybody else to make sure that we're on the right side of history with this deal. And then here's the deal. Some of you were asking about, stomach issues, digestive problems, taking medications. That's the deal. The more drugs you're on, the more poison you have in your system, the more risk you have for all this stuff. Please understand that. Please understand that. Many of you guys were asking last week, we were talking about the probiotics, and we were also talking about enzymes and how they go together and they work together. So like Lori says, what if zinc upsets your stomach? This is exactly, Lori, what I'm talking about. That's why you need, if any of these vitamins upset your GI tract, that means you're not absorbing them. I need you to understand something. Everyone watching this, there's a big difference between putting gasoline in your tank and that gasoline going into your engine. So the bottom line is this. Most people are not absorbing their nutrients. That's why you need to get on an enzyme. Multi-enzymes are essential. And I'm telling you guys, Zach Bush and I were talking about this not too long ago, about the importance of probiotics, good bacteria to improve the immune system, but people are just not absorbing their foods. That's part of the issue. That's part of the problem. So multi-enzymes, it's a digestive enzyme. Digestive enzymes that have amylase, lipase, and protease in it. And if you're going to get one, you've got to get one. You've got to get one that has a plant-based enzyme in it. It has to be plant-based. Someone just mentioned, they said there are plenty of 28 to 48 age people that are dying though. No, there's not. No, there's not. If you look at the numbers, that's a small percentage. Less people are dying from COVID-19 than they are from the flu of those age groups. Please look at the numbers. Go to the CDC and look at them. They've got death by age groups. It's 80% of people are above the age of 80. The chances of someone dying under the age of 18, which is considered a child, is statistically zero. It has happened. 174 people have died. 185 now have died from H1N1 of the same age group. Please understand that. Mark, yes, it's important to still get tonic water, which has quinine in it, or drink ruby red grape juice or grapefruit juice, because that's a zinc iontopher that allows zinc to get in the body. Probiotics and enzymes. You've got to have a good GI tract. You've got to have that. And if you're not absorbing your nutrients, you guys, you're gonna get an upset stomach. If you eat food and you get heartburn, reflux, upset stomach, or fatigued after you eat, or you swell, or you have pain, you've got to take a digestive enzyme. You've got to do that. And if you don't, you're not going to absorb your nutrients. That's a big deal. Foods that we should be eating right now, tons of dark leafy green vegetables. We need those phytonutrients and antioxidants. We need to be taking elderberry. If you have a really immunocompromised, if you have an immune compromised system, go and get your body on some astragalus. Astragalus is amazing. Astragalus, a dose of that every day will help your immune system. So you need some type of iontopher that opens up the cell membrane, the electron transport train, for that to go into your system. So please, there are so many things you can do to improve your health. Go outside, live your life. Don't live in fear, and understand that no one's going to throw you in jail for not wearing a mask. No one's going to give you a $500 fine. And if they do, you're not responsible for paying that. Get a lawyer. They will tell you in a minute that it won't. If you have inflammation, arthritis, all that stuff, it's usually because of enzyme deficiency. Most people, especially most Americans, because we eat a standard American diet, do not absorb our nutrients. If we don't absorb our nutrients, then we can't. It's like gas going into our tank, but not into our engine. Does that make sense? So there's so many things: the vitamin D, the vitamin C, the zinc. You guys, getting antioxidants in your system, eating a clean, healthy diet, getting your weight on the right path. Obesity is the number one cause of heart disease, cancer, diabetes, stroke, dementia, Parkinson's, and Alzheimer's. That's what people need to get under control, so that you don't have those symptoms and those diseases, so you don't have to be on the drugs, because the drugs cause the body to be poisoned and sick. That's the deal. We got to get healthy. The answer for all this is we need more people less sick. It's not just wash your hands. It's not just social distance. It's get your immune system boosted. That's the key. You guys, fear is false evidence appearing real. That's it. If you're going to get supplements, going to get nutrients, make sure that you get plant-based, whole food, non-GMO. The non-GMO is the key. If you have IBS, irritable bowel syndrome, Crohn's, colitis, you have got to get on a multi-enzyme. If you're having trouble finding a multi-enzyme, I see a lot of you asking about what brands. Go to warriordigest.com. Go to ericnaputi.com. Go to click our links. It's there. And by the way, Kendra, great question about elderberry and cytokine storm. That only happens when our body's sick. That only happens when we don't have enough vitamin D, vitamin C, when we don't have enough of an immune system response. That's when it happens. Elderberry is amazing. I've got probably 40,000 patients on elderberry right now with no problems whatsoever. It's important. John, you're right. Fix insulin resistance. That's the key. That metabolic reset program we do is all about that. It's all about that. We need more people less sick. That's the key. That's the message that needs to get pushed from the pulpit. That's the message that needs to get pushed from TV. It's not just, oh shit, Florida has 15,000 cases. That's because they tested 140,000 people that day. They should talk about the fact that the percentage of infection rate has gone down. That's good. You guys, we forget common math. Simple. Yes, you can get healthier. So I got to get going here in a second. But I just want to tell you how much I love and appreciate you guys. Don't just listen to the propaganda. Please don't. Go to ericnaputi.com. Join the message. Join the movement. ericnaputi.com. It's below. Click that link or share this. Share that link too. And then they just put a thing in there about digestive enzymes for you guys. You guys have, those of you that are asking about how to boost the immune system, go back and watch it from the beginning. Get your weight under control, get your insulin under control, vitamin D, zinc. So that boost pack we have is for that. It boosts the immune system. That's why we did it. D3, digestive enzymes, drinking and eating probiotic foods that have fermented foods in it, drinking water, getting outside and getting vitamins. That's the key. And living your life not in fear. Live in faith and in facts. That's what you need to do. That's the key. That's the key. And please share this. Please share this. Our message is getting suppressed so much, and this is what people need to hear. This is what people need to hear. I love you guys. I appreciate you guys more than you can even know. But I need us to wake up and wake up more people. We have to do it. We have to do it. If we don't, who's going to? The answer is nobody. And if not now, when? It's going to be too late. So for the love of God, for the love of our country, for the love of our world, for the love of your children, wake up and see the facts. Wake up and see the facts and stop living in fear. The same thing that's happening in Florida is happening in Texas. The politics of the northern states are trying to reprimand the southern states that didn't comply with what they wanted, with their agenda. We have to support each other. So God bless you guys. Have a blessed day. God bless America. Go back and watch this again. Rewatch it. And share it with your friends and family. If you guys find some vitamins and supplements, click on that link below. We'll help you with that. I love you guys. I appreciate you. Be blessed. Bye, everybody.